Hormones are substances that are created in the human body that affect tissues distant from the point of production. Hormone replacement therapy typically benefits those people between the ages of 50 and 70, or the typical ones that seek it anyway, but it can benefit anyone over the age of andropause or menopause. So bioidentical means the substances are created that are exactly identical molecularly, chemically. They're exactly the same as substances that are produced in the human body. Usually, we start with botanical material and tweak them in the laboratory until they're exactly the same as a human hormone. The symptoms and signs are fatigue, loss of hair, inability to grow fingernails well, hot flashes, night sweats, gaining weight, feeling cold hands, cold feet, but feeling too hot in the core of the body, loss of libido. All of those signs and symptoms point toward hormone deficiencies. The best tests are blood studies. So we send the patient to the laboratory, blood is drawn, and measurements are done for cholecalciferol, which is the so-called vitamin D3, which is a hormone, 3 thyroid studies, the TSH, the free T4, and the free T3, estradiol, progesterone, testosterone free and total, as well as DHEA, sulfate, and in some people we measure the cortisol levels. Hormone levels need to be optimized, not simply get a level that adheres to a reference range that's listed on a laboratory sheet. The laboratory report will list a measurement of the hormone, and their expertise is in measuring. However, they're required by regulators to put down a reference range or a reference interval. And they have no particular expertise in determining what this interval should be, but they put one down simply to be in compliance with regulations. So optimization may be very different from levels described in a so-called reference range. And again, the laboratory company does not have any particular expertise regarding reference ranges of hormones. So here are some examples of struggles that I've had with patients in the past, or I've noted with patients in the past. A man may go to his general practitioner and ask him or her for testosterone replacement therapy, only to be told that it's not an important thing to do, or it's that his testosterone level is not low enough in order to optimize it with replacement therapy. Another common one is thyroid replacement therapy. Thyroid replacement therapy is not generally done in the United States. So people with low thyroid function are typically given the inactive form of the thyroid hormone and then asked to provide blood samples on a regular basis, none of which has much to do with fixing the low thyroid problem. Another example is the woman going through menopause, and she's told by her family practitioner that she must take some hormones only for a limited period of time to get her through a few years of hot flashes and night sweats, and totally ignoring the health benefits of restoring estradiol and progesterone levels. Well, the problem with hormone decline is that it occurs at a particular time in life. For women, it's menopause. For men, it's about the same age, about the age of 51, andropause. But in women, their hormones are in their faces every month. And so when things go awry, they can feel it, and they feel it very greatly typically. For men, it's a very slow, linear process. He comes home at age 27, plays with the kids, and waits to be called for dinner. At 37, he comes home, sits in the easy chair, and waits to be called for dinner. 47, he comes home, sits in the easy chair, and goes to sleep before dinner. So it's a linear process. He loses drive, energy, motivation, and also libido. For women, it's a period of time, rather like a roller coaster, typically in the late 40s, and then by age 51 to 55, menstruation ceases. Hormones that are produced by the ovaries or during youth are very low, and there are health consequences to pay for that. It's not just how you feel, but it's also the start of the deposition of plaque on the inside of arteries. It's the start of loss of bone density. It's the start of loss of brain function. And it is most noticeable by the time a person in their 70s, for sure. Some people, it's by the time they're in their late 50s, heart attacks start, strokes start, and then it accelerates from there. The misnomer comes when substances that are really drugs, that are not really found in nature anywhere, are referred to as hormones, quote unquote, simply because they attach themselves to hormone receptor sites in the body. However, they don't trigger those receptor sites the same way that substances that are created in the body do. Consequently, there are side effects, sometimes very egregious side effects. The Women's Health Initiative pointed this out. The Women's Health Initiative did not really study hormones, but studied the drugs that were given at that time frame, during that time frame for hormone replacement therapy. So this includes horse estrogens, conjugated horse estrogens that are produced from the urine of pregnant mares. Also, medroxyprogesterone, which goes by the brand name Provera. It's commonly referred to by doctors and researchers as well as progesterone, but in fact it's not progesterone. Progesterone is made in the human body. Provera is not made anywhere in nature. Well, drugs can cause cancer, and it's been demonstrated that the drug Provera can increase the risk for breast cancer. And that was demonstrated in the Women's Health Initiative. But the way it was reported to the public is that progesterone causes cancer. And of course, that's absolutely incorrect. Progesterone prevents breast cancer. Provera can cause breast cancer. So that's an example of the situation that has arisen over the past 15, 20 years or so, where mistakenly drugs have been reported as hormones and thus condemned as causing cancer. Bioidentical hormones do not cause cancer. Drugs can cause cancer. There are really not too many doctors who are trained in bioidentical hormone replacement therapy. And if you expect to engage in an anti-aging program, you need to find someone who has been trained specifically to treat hormone decline seen with andropause and menopause. This is what you can expect to have when you're engaged in an adequate anti-aging program.